afternoon, and welcome to this community briefing on our ongoing pandemic response efforts. Providing interpretation for us today, once again, is Margie Prop, and thank you to Margie and to all of you for joining us. Sunday marked the 2-year anniversary of the first case of COVID-19 reported in Lancaster County, a moment that I will never forget when epidemiologist Raju Karkalapudi was saying, "That moment just changed our lives." And as time went on from that fateful day, it became clear that protecting our community during this historic pandemic would require a long-term and collective effort. At one briefing, I referred to our efforts as a marathon, not a sprint. We hoped we were close to the finish line last summer when our COVID-19 risk dial was in green for 10 weeks. But this unpredictable, now not so novel coronavirus reemerged in a new form and once again threatened lives and the more familiar patterns of daily life that we all desire and enjoy. More recently, however, the key indicators that our health team has been tracking and sharing with you these past 2 long years began to trend in the right direction again. As Health Director Pat Lopez will show us in a few minutes, these positive trends, especially the decline in the numbers of individuals hospitalized and on ventilators, they are finally providing relief to our dedicated healthcare professionals. And the number of new cases reported daily has dropped to single digits, and we have not had a death from COVID-19 since March 10th. Given our progress, we are so pleased to announce that our risk dial is moving to green, indicating a low risk of the virus spreading in our community. We have not been in green since late July of last year. We've reached this milestone because of you, our residents, and the positive actions you've taken to protect yourself and others. More than 66% of our entire population in Lancaster County is fully vaccinated, and approximately 60% have received a booster. Thank you. Thank you so much for doing your part to protect yourselves, your loved ones, and our entire community. It bears repeating what Health Director Pat Lopez has stated in previous briefings. We know this virus is unpredictable, and we do not know what may lie ahead. Our public health professionals, medical community, epidemiologists, and scientists will continue to work diligently to track the virus and any new variants and to manage our response efforts. We all want to maintain this hard-won progress, and each of us has the power to ensure that we do. And here's what you can still do to help keep our community in the green and protect the good life. If you are not yet fully vaccinated or boosted, seize this moment to get yourself across the finish line and bring home a lasting win for our community. As I turn this over to Director Lopez, I again want to praise our local public health team for their hard work, their dedication, and their compassion. Their heroic efforts have prevented illness and saved lives. From the EPI team that helped us measure the risks and our progress, to the logistics and finance team who have sourced and secured personal protective equipment from the earliest days, to the contact tracers who spent hours on the phones racing against time to notify people of exposures and to help stop the spread, to the nurses who sat for hours at Pinnacle Bank Arena, vaccination clinic stations, administering doses, even dressing in capes and costumes to make the experience better for the children who bravely rolled up their sleeves, to my favorite nurse of all, who led the way from day one. Our community is forever grateful to you, Pat Lopez, and to your team for your selfless sacrifices and extraordinary service. I'm going to hand it over to Pat now.
Thank you, Mayor. As the Mayor mentioned, our local indicators have dropped rapidly. Our risk dial was still in red, the highest risk level, the week of February 8th. But that dial has moved down step by step over the last several weeks. And as the Mayor announced, we have again reached green. And here's what the latest data is telling us. On this chart, you can see that all but one of the key metrics used to determine the location of the dial has now moved into green. Hospitalizations remain the only metric in yellow. And this chart shows the declining 7-day rolling average of COVID-19 patients hospitalized locally since the beginning of February, from 135 to an average of 29 at the end of last week. The decline has been significant, but it has slowed in recent weeks. And this chart comes from our COVID-19 dashboard. On the right, you can see the dramatic drop in hospitalizations over the past weeks. However, we're still higher now at around 30 than back in June of 2021. That was the last time the number of COVID-19 hospitalizations dropped below 10, and we hope to keep progressing and get to that point again soon. Over the past week, the number of new cases continued to decline, and as the chart shows, we finally dropped below 100 cases in a full week. This hasn't happened since July of 2021. This is also a stark contrast from the beginning of 2022, when we had nearly 5,000 new cases reported the week ending January 15th. We've also seen the positivity rate stay below the 5% threshold for 3 consecutive weeks now. This past week, ending March 19th, the rate dropped to 3.4%. Again, that's the lowest rate since July of 2021. With significant improvement across all key indicators, it is satisfying to see the dial finally move again to green once more. Here on the color-coded map, you can see that nearly all the dial metrics are in green. The position of the dial can be seen in the green area of the map, represented by the blue square outlined in red. Green on the dial indicates a low risk of spread and impact to our community. Our local public health guidance for green can be found at our website, covid19.lincoln.ne.gov. Green is a great place to be, and I really want to thank everyone who helped us get there. However, the future course of the pandemic remains uncertain, and we know from past firsthand experience how quickly our local situation can change. With that in mind, we're paying close attention to other possible variants that could impact us locally, like BA2, another version of the Omicron thought to be more transmissible. This new variant is becoming more common in the U.S., and CDC data shows it makes up about 23% of all COVID-19 variants identified as of the week ending March 12. So far, 18 cases of BA2 have been identified in Nebraska, including one we were notified of today in Lancaster County that we're currently investigating. What is not known yet is whether this variant could cause a small uptick in cases or a large surge. That's why it's important to remain flexible. If our local situation changes, we will reevaluate current recommendations and make adjustments as necessary. Staying up to date on your COVID-19 vaccination plays a critical, really a key role in maintaining strong protection against the virus and keeping it more manageable as we move forward. We continue to hold vaccination clinics almost every day at the health department and other locations that are convenient and close to home. Find a clinic near to you at our website or by calling 402-441-4200. As you may be aware, Moderna asked the Food and Drug Administration to authorize a second booster of its COVID-19 vaccine for all adults last week. And recently, Pfizer also requested FDA authorization for an additional booster dose for adults 65 and older. The FDA's advisory panel is scheduled to meet April 6th to discuss future boosters. We are monitoring these developments and will provide more information as it becomes available. And we're really already in the planning stages to prepare should that be recommended. Also, as far as COVID vaccine for children under 5, the FDA postponed its February advisory committee meeting to allow more time to review and evaluate additional data from the ongoing clinical trials. A new date for that meeting has not yet been set. And as the mayor said, currently more than 66% of our entire population is fully vaccinated, and around 60% have received a booster. Having a high level of immunity against the virus in our community helps us be better prepared if there are future outbreaks. And finally, I want to provide a quick update on flu activity, which is increasing in Lincoln and Lancaster County and nationwide. Flu cases are represented by the multicolored bars on the chart you're looking at. As you can see, cases here peaked in late December and then dropped to low levels, but in the past several weeks have started to rise again. Currently, the majority of flu cases are influenza A, which tends to cause symptoms that are more severe. About half of flu cases are in people 13 to 29 years old, and those 65 and older account for 7% of cases at this time, but that could also change. It's not too late to get your flu vaccine, which is recommended for everyone 6 months and older. And in closing, I just want to say our community is in a better place, at least for now. We will suspend our weekly COVID-19 briefings for that time being. That doesn't mean the virus is going away. And as I mentioned, we will continue to closely watch other possible variants that could impact our local situation. And if there are additional developments, we will share them with you. Staying current on your COVID-19 vaccine is vital, and vaccination will remain part of our ongoing response effort in the weeks and the months to come. Now is a good time to get vaccinated and boosted or caught up if you're behind. We will continue to communicate any updates on vaccination recommendations and hold clinics in places that are accessible, convenient, and close to home. We'll also keep updating the dashboard and issuing written updates every weekday. The updates are posted at covid19.lincoln.ne.gov. And if you use social media, you can follow the City of Lincoln and Lancaster County Health Department on Twitter and Facebook. And if you have COVID-19 questions or seeking general information and resources, the hotline is available Monday through Friday from 8 to 4:30 at 402-441-8006. And with that, we're happy to take any questions.
Hi, Pat. This is Matt with the Metro Star.
Hi, Matt.
Hi. I wanted to ask you, I know you guys do wastewater monitoring, and I'm sure you've seen that they've started to see upticks in COVID and wastewater in a lot of communities. I just wondered if you happen to know what the most recent testing here showed, whether it's still showing declines or whether it's leveling off or showing any uptick there.
Actually, we have heard that, and I saw some information on that today. And our team had been talking about that they were seeing a slight uptick. That's another group doing testing on wastewater, and we're not sure of their criteria or how they're doing the testing. But we have been using, through Lincoln Transportation and Utilities, I think you know, Matt, we've been monitoring wastewater for some time now. And we're doing that through BioBot, and we have not seen an increase. I just reviewed the data again this morning, and we're really not seeing that uptick at this point in time in our community.
Okay, great. I just had one more question about the green, being in the green in the risk dial. Does that change any sort of regulations or public guidance or anything like that, or is that more just a recognition that we've reached a good, even better point in the pandemic?
It's a recognition that we've reached a better point in the community, but we still recommend people who have underlying health conditions wear a mask when they're in crowded areas. And especially, I think you'll notice that there are several people who continue to wear their face covering for whatever reason. And whether it be they have an immune problem or they're trying to protect loved ones or they're not able to get the vaccine. So we'd still recommend that. But as far as other restrictions, there aren't any, and we encourage people to go about their daily business as usual.
Okay, thank you.
Mm-hmm. And I just want to remind everyone, too, that we do have free test kits available at the health department Monday through Friday from 8 to 4:30, and you can feel free to just stop in and pick up kits if you need them, to keep them on hand. So if you have a need in the future, you have them readily available to you. Any other questions? Okay. Well, we're excited that we've gone green in Lancaster County, Lincoln. And I want to thank you again for joining us today and remind you to get vaccinated and get your booster. Thank you.